Eromia is a software for use in rheumatology for electronic data recording. If you have been considering a way of regularly collecting your patient's disease activity parameters in your standard clinical practice whilst you are seeing the patient, Eromia is the ideal option. Eromia meets your targets for improving your working practice electronically. Now let me take you on a tour through Eromia. On the Welcome to Eromia page, you have two options. One for patients with arthritis, the second for patients with ankylosing spondylitis or spondyloarthritis. I'm going to show you how to use Eromia to record the disease activity measures for a patient with arthritis, as it would be collected during a routine clinic appointment. Eromia can be easily and quickly used whilst you are with the patient in the consultation room. Under arthritis, you have several options. First is to add a patient's visit. Next is to edit any existing patient's data. Next, find any visit of a previous consultation. Add a new visit data, patient analysis, disease activity analysis, and lastly, to modify any previous visit you may have recorded. Let's start by adding a new patient. Enter the patient's name, their date of birth, and their hospital number. Save and close. Now we need to add the new visit data for this consultation. Enter the first letters of your patient's name or choose them from the drop-down list. Next, enter the date or click on Today. The patient's hospital number and their date of birth will automatically appear in these boxes. Now enter the patient's GP. First, enter the doctor's initial and name, their surname, and their address. Close this box and find your GP in the drop-down box. Their address will automatically appear for you in the GP address box. Next, enter the rheumatologist seeing the patient in this visit, either from the drop-down list or by entering a new name. Their diagnosis can be entered either by dropping down the list or by entering the first letters of the disease. Current DMARD therapy can be entered in the same way. Either choose from the list or enter the first letters of the DMARD and it will automatically drop into the box for you. Record their dose. Any current biologic therapy can be entered in the same way. Other current medications can be listed. Any past DMARDs can be added from the drop-down lists or by entering the first letters of the DMARD. The dosage can be entered and the reason the patient had to stop this particular DMARD therapy. Past biologic therapy can be entered in the same way, and the reasons also recorded. Any past medical history noted. or any joint surgery the patient may have had. The patient's blood pressure during this visit can also be recorded. There's a section to record any specific complaint the patient may note during their consultation. Any new systemic manifestations your patient may note can also be added by using drop-down boxes or adding the first letters of the problem. Cardiovascular risk can be recorded again by using drop-down boxes. Falls risk can be recorded in the same way. Any spinal affection or soft tissue affection. The next section is to record the patient's parameters of disease activity. Tender joint count, patient self-reported tender joint count, swollen joint count, duration of morning stiffness, pain score, patient's global assessment, physician's global assessment, fatigue score, their grip strength on the left and on the right, rheumatology attitude index, inflammatory bowel disease score if it's relevant to your patient, functional disability, quality of life, ESR, CRP, PASI score if the patient is suffering from psoriatic arthritis, and psoriasis quality of life score. There are boxes for other relevant blood tests. The DAS score can be automatically counted by selecting the score relevant to your patient. It will automatically appear in the DAS score box. Falls risk can be entered from a choice of low, intermediate or high. Any comments regarding the patient's treatment plan or examination during the consultation can also be recorded. Any non-steroidal anti-inflammatory drugs suggested, painkillers, and whether your patient required a steroid injection during their visit. Any DMARD therapy advised, or biologic therapy which may be suggested. Any laboratory requests can be entered. Any X-rays requested, and any relevant reports. The last box is to record when the patient will next be coming for a clinic visit. Once you've completed this page, click on the patient's joint